Good evening and thanks so much for joining us for this update from your coronavirus headquarters. I'm Martha Koloski. Some local health officials in Wisconsin are rescinding their stay-at-home orders as attorneys warn they may be on shaky legal ground after the Wisconsin Supreme Court struck down a statewide order. Now, meanwhile, taking a look at the latest numbers, nearly 11,700 people have now tested positive for COVID-19 in Wisconsin. 445 people have died. 6,200 people have recovered from the virus. There was a 21% increase in the number of cases in Wisconsin since last Friday, and the number of deaths is up nearly 16%. Both of those totals are decreases from the past few weeks. La Crosse County had no new cases today. 2 new additional cases, though, are being reported in Vernon County. 1 new case is also being reported in Crawford and Monroe counties. Switching over to Minnesota, there are now a little more than 14,200 COVID-19 infections. 683 people have died there. Nearly 8,800 people in the state have recovered, and there has been a 41% increase in the number of cases in the past week in Minnesota, and nearly 28% increase in the number of deaths over that same time frame. Those are the lowest percentage increases for those weekly numbers since March. In Iowa, Allen McKee County has 116 cases, and then in the entire state, a little more than 14,000 people have tested positive. 336 people have died, and there are more than 6,500 recoveries. The number of cases in Iowa is up by 22% over last week. That is the lowest number of cases reported in a week since the middle of April. That comes following a week with 5 of the 6 biggest testing days in the state. And Winona Health is learning more about the spread of the coronavirus in the community through new antibody testing. The healthcare provider says it's conducted about 1,000 tests just this week, and it's already found about 70 patients with antibodies. News 8 Now's Mal Meyer explains what that could mean for our area.
Sharon Reister doesn't think she had the virus.
But there's many asymptomatic people out there, and so that's what I'm interested in knowing, is maybe I have had it without any symptoms.
As a nurse, she's been especially curious. That's why she's getting 2 different tests. One to show if she's currently sick, and another to see if she's already been exposed to COVID-19.
I think for safety purposes, I'd like to know if I have that antibody and can prepare for what's to come yet to our clinic setting.
Winona Health says businesses, long-term care facilities, and other community members have been asking for the testing.
Many people think that they potentially have had it, but they just don't know.
Since starting the test earlier this week, they've had about 100 patients per day coming in to get that answer.
We were not expecting that big of a number. However, we have adjusted our processes to accommodate that.
They're specifically looking for an IgG antibody, which typically shows up about 14 days after the initial infection as the disease is clearing.
There's a lot of research that's being done right now to determine how long do these antibodies remain in the system and to what degree do they confer resistance or immunity.
He warns for those who do test positive, it suggests that you may have some resistance in the future, but not guaranteed immunity.
Just like a flu shot causes you to get antibodies to the flu, it doesn't mean you're not going to get the flu.
The test results also give medical staff and leaders a picture of the prevalence of the spread, if we are nearing herd immunity or if there's already been a peak in cases.
If we don't see a lot of antibodies, it means that we have potential to get a big spike, so it allows us to plan and prepare a lot better.
Initial tests indicate the prevalence in the community is relatively low, which may mean there may be a surge in cases coming, but further testing could help them know more. In Winona, Mal Meyer, News 8 Now.
And anyone who wants to be tested for antibodies can go to the Winona Health Clinic from 8 a.m. until 5 p.m. Monday through Friday. They're also testing people from 8 a.m. until noon on Saturday. They do ask that you wear a mask, though, and if you come in, the cost will be billed to insurance, and Winona Health is still looking at what will be covered. Results will be released to patients within 3 days. And the University of Wisconsin school system is working on plans to test all of its students, staff, and faculty for COVID-19 in hopes of returning to in-person classes this fall. System administrators say it might not be possible. Current testing may cost them about $100 per test, meaning it would cost more than $20 million for just one round of testing. UW system officials say they don't want to just do one round, but rather an ongoing series of testing based on need. Contact tracing, also providing PPE gear and social distancing plans could be in place as well. And the administration will be reviewing at its budget early next month to get a better idea of what the fall semester could look like. And a mass COVID-19 testing site will be available free of cost to La Crosse County residents. Next Thursday, the La Crosse County Health Department, City of Onalaska, and the Wisconsin National Guard are hosting drive-through testing. It will be at the Onalaska Omni Center from 11 a.m. until 7 p.m. or until the tests run out. Anyone age 5 years of age or older who is currently experiencing mild to moderate symptoms associated with COVID-19 are encouraged to attend. Following the testing, people should return directly to their home and isolate themselves until they receive their test results and further guidance from public health officials. And also, people will be notified of their test results by phone within 24 to 48 hours. Also, make sure you do bring a book or something else in your car for entertainment while you're waiting in line. And keep in mind that antibody testing will not be conducted at this event. And the City of La Crosse is forming a new task force. It will focus on developing guidelines for large events and gatherings. This includes festivals, parades, concerts, and tournaments. The city requires special event permits to hold these gatherings, and it is working closely with the health department to make decisions about granting these permits through the summer and fall. In mid-June, the task force will be meeting with Oktoberfest organizers to discuss plans and preparations. And thanks so much for joining us for this coronavirus update, and we hope you can join us again tonight at 10.